Hi there, this is Jonathan Ginsberg. I'm a Social Security Disability attorney in Atlanta, Georgia, and I'd like to talk to you today about a medical condition that you may or may not have heard of, but it's something that could apply in your case, and I want you to know what it is, and that's idiopathic diseases. And idiopathic diseases are those where there is no definitive objective cause or evidence of the disease, but you're suffering the symptoms anyway. And of course, the most common idiopathic disease that we see is fibromyalgia, where the medical testing has not yet caught up with what's really going on. There are people with fibromyalgia and these chronic pain conditions that they are suffering, that my clients are suffering, yet there's no objective test you can take to do it. Chronic fatigue is another example of that. And these are very real conditions, but there's no objective test that's been developed to evaluate or to determine the degree or severity of the condition. And there's some other idiopathic diseases that you may come across, and I made a list of them, and let's go through some of those. I see idiopathic epilepsy. That is when a person is suffering seizures, but there's no evidence in brain scans as to what's going on, but the seizures are very real nonetheless. Idiopathic neuropathy, that's when a person has pain in the nerve pain in the arms or the legs or elsewhere in the body that is causing significant problems, but it still is not objectively showing up on an EMG or other type of test. Gastroparesis, this is a situation where the stomach muscles do not work to push foods through the gut, and as a result a person will have extreme abdominal pain. They may have constipation or diarrhea depending on the medications, but there are cases where somebody has idiopathic gastroparesis, and it's very real to the person, but there's no, the gastric emptying studies that are being done and other evidence, other testing that's being done does not show any evidence of damage to the stomach muscles. So the disease is very real, but there's no direct cause to it. I see idiopathic hypertension where the blood pressure is very high. There are headaches, there's dizziness, but again, no objective cause to it. Idiopathic hypersomnia where somebody is basically sleeping all the time. We don't really know why, but they cannot stay awake. Idiopathic constipation, diarrhea, again, those are kind of the gastroparesis example. But situations where a person has severe gastric distress, but we don't know exactly why, there's no objective testing for it. So, excuse me. So basically, if you have an idiopathic disease, it can be very, very real, and those cases can be viable and they can be won. Here's what I look for when I'm dealing with an idiopathic disease. First of all, there cannot be any evidence of malingering or drug-seeking behavior, and that means that you don't want any doctor to say that you are basically delaying treatment so you don't have to go back to work, or that you're delaying treatment because you want to stay at home. Of course, you don't want any doctor to say that you're asking for pain medications because you are looking for drugs. This is especially true if you're seeing multiple doctors and different doctors are giving you pain medications. Doctors are very, very sensitive to that, so if they find that you are getting pain medication from another doctor and not telling them about it, they'll label you as drug-seeking, and that label can follow you around and destroy your opportunity for getting disability benefits. Oftentimes there is a psychological or psychiatric component to idiopathic diseases. That may be because some of these conditions there may be a mental health component to them, let's just put it that way. So sometimes we do look for that, and I'm looking certainly for a person to go see a psychiatrist or psychologist to at least rule that out. There should be an extensive record. In other words, what judges are looking for is somebody who goes from doctor to doctor to doctor looking for some sort of help. By the same token, if you're seeing 7 or 8 doctors, nobody's finding malingering or drug-seeking behavior, all of them are expressing frustration, that's a good sign, especially if they all acknowledge that your symptoms and conditions are real. The next thing is you want to make sure that there is good compliance with treatment. And what that means is that whatever the doctor tells you to do, you need to go ahead and do. So you can't be a person who's refusing to undergo treatment or testing, even if the testing is unpleasant, uncomfortable, even painful. Judges will expect you to go through all that in a good faith effort to find out what's wrong. So that's kind of an overview of idiopathic diseases. And again, if you hear that word, that's what that means, and they can be legitimate cases, but again, we're going to have to work a little bit harder because it's certainly easier to go into Social Security court with a MRI or with an EMG or a CT scan that shows something very specific, but you can still win without it as long as you've got medical support. And that's really the final thing, is you want to make sure you've got a doctor who will support you, ideally by filling out a functional capacity form or writing a narrative report that identifies the specific activity limitations that you can no longer engage in because of your condition. Hope this has been helpful. Again, Jonathan Ginsberg here, and I will anticipate any questions you got. Please let me know. Thanks a lot.